A perfectly performed ACL reconstruction may fail. There may be single or multiple causes. Even in ideal circumstances, around 10% of all ACL reconstruction fail. Hello friends, I am Dr. Tirthendra Khadka. I will be sharing my experience on ACL graft failure, starting with a case that I recently operated. 38 years old gentleman attended my OPD with clinical features suggestive of ACL graft failure. His X-ray shows little anterior femoral tunnel. MRI shows disruption of ACL graft and medial meniscus was not visualized. CT scan was performed and there was no tunnel dilatation. Diagnostic arthroscopy revealed complete tear of reconstructed ACL. There was complete absence of medial meniscus and there was coronal damage at medial femoral condyle. Absence of medial meniscus is an important risk factor for ACL graft to stretch out.
Yeah, Dr. Rao, what do you think? What is the cause of failure of ACL that we are frequently getting such cases? What do you think? Why is ACL are failing?
So most commonly it seems like sometimes inadequate assessment and hidden lesions of meniscus are leading cause of failure.
I can assume that there was medial meniscus tear which was not repaired and the meniscectomy was performed. Fixation was not adequate and there was lack of additional procedures. All these leads to the condyle injury and rupture of ACL graft in previous case. The most common cause of ACL graft failure is technical error. Around 70% of failure are due to technical error, incorrect tunnel placement, that is too vertical or anterior femoral tunnel or too anterior or too posterior tibial tunnel leads to graft impingement, abnormal kinetics and early graft failure. Anterior placement of graft on femur may produce deep Lachman's test, but these patients often have positive pivot shift and have instability with twisting, turning or pivoting activities. On the other hand, the central or too posterior position on the tibia does not allow for rotational control, so these patients may have problem with instability, with twisting, turning or pivoting. Second most common cause for ACL graft to fail is failure to address secondary instabilities, posterolateral condyle injury, MCL injury and lesion of the medial meniscus root, ramp or posterior horn tear can be easily missed. Biological issues are also associated with ACL graft failure. Quality of the graft and diameter of the graft directly affect the prognosis of ACL reconstruction. Poor quality and small diameter graft are cause of ACL graft failure. After a good ACL reconstruction, the patient needs good rehab. If the rehabilitation is not good, then there is chance that ACL graft may rupture. The patient should get proper instruction regarding return to sport and weight bearing. Return to sport after 6 months and after proper physiotherapy is highly recommended. Finally, reconstructed ACL may fail due to trauma. Around 5 to 10% cases of ACL reconstruction failed due to trauma. Thank you.